Hello and welcome to this morning's discussion here in the European Parliament, brought to you today by Euractiv with Gilead. We're going to be talking about ending HIV in Europe. Now, the EU has set itself the target of ending the HIV epidemic by 2030. We're going to ask today whether that is feasible, is it on track, and what can we do to make sure we deliver on that aspiration. In the European Union, the EEA region, there are more than 750,000 people living with the virus and approximately 23,000 new cases each year. We're going to talk today a little bit about a new report that has been published by Boston Consulting Group for Gilead Sciences. And that report has 4 key recommendations to help us reach that target. One is to allocate more resources to PrEP promotion and to increase its uptake, to incorporate an opt-out approach for HIV screening under certain circumstances. We'll get into the details on that. Also to expand HIV care delivery beyond the traditional setting, so maybe to look more at healthcare in the community. And finally, to define and implement tools to measure health-related quality of life. Also, a very tall order. So we have a great lineup of panelists to discuss that today. So I'm delighted to welcome to our discussion Mark Angel, MEP, Quaestor of the European Parliament and co-chair of the LGBTIQ+ intergroup and a member of the informal working group on HIV here in the Parliament. Also, his co-MEP, Nicolás González Casares, who's a member of the Sant Committee, the Health Committee in the European Parliament. Joining remotely, Julia Del Amo is Director of the Division for the Control of HIV, STI, Viral Hepatitis and Tuberculosis within the General Directorate of Public Health in Spain under the Spanish Ministry of Health. Nicoleta Policek is Executive Director of the European AIDS Treatment Group. Christoph Spinner, Chief Operations Officer and Hospital Operations Chief Medical Information Officer, something I'm sure will be relevant to us today, and Consultant Physician for Infectious Diseases at the Technical University of Munich University Hospital. Joining me also as well is Mercy Shibemba, who is co-author of that report and will be able to tell us a lot more about it. And finally, last but not least, we are delighted to have Neil Mulcock, VP of International Government Affairs at Gilead. So, ladies and gentlemen, we've a lot to get through in the next hour and a half, and I will remind our online audience that they can ask questions of our panellists. Simply use the box on your screen. You can scan that QR code to go to Slido or type your questions in, and we'll get as many of those as possible. Time 2030 targets. Give me your initial thoughts on whether we can or not.
Of course, we can reach these targets, and we must reach these targets. And a lot has been done in the last 40 years, so we just have to do this extra mile and this last mile, and we're quite close. But we have to step up our efforts. And for me, I'm very happy that Euractiv organizes this debate together with Gilead, because it's important to bring together companies, scientists, politicians and civil society activists, and it's only together that we can reach these goals. And for me, as a red ribbon leader of UNAIDS, the human rights dimension has always been very, very important. And this is a fight we have to continue doing, because there's too many intersecting inequalities still existing, and they continue to drive the HIV epidemic. So this is one lesson we learned, and we have to work on that dimension. Another lesson, I think, is also that we really put the human rights in the center of everything. And when I see that there's too many discriminatory laws, that now the anti-gender movement wants to forbid sexual and relationship education in schools. This is important for prevention, that sexual and reproductive health and rights are under attack. This is very worrying, and this is where we also have to act, especially also as politicians, together with civil society. And then a last lesson, and we know it all, investing too little and too late has a huge cost for humanity. And we've been investing too little, and we are a bit late, but I'm an optimist, so I think we can go forward. And this is what in the European Parliament we are very active in. And I'm very happy that now 2 European parties finally also joined the global partnership against discrimination and stigmatization in HIV/AIDS, because I was shocked when I heard about that initiative that no EU member state was in it. Now Luxembourg and Spain have joined, and we call on all member states to be active, because there's still too much stigma and discrimination.
We'll hear a little bit more about Spain in just a moment. But Nico, let me come to you and ask your thoughts on whether we can achieve these targets, bearing in mind there are a lot of intersecting challenges.
First, let me say that I'm pleased to be here on this debate organized by Euractiv and, of course, with the collaboration of Gilead. And I agree with my colleague and friend Mark. I think that we are not yet on track, but we can do it. We can achieve it by 2030. But we have to run, and we have to make new efforts, mainly in that we are having big problems with growing incidence in some Eastern countries. I think that the prevalence in the Western countries is more or less decreasing, but we have an increasing incidence in the Eastern countries that we have to tackle. So without doing this, it's going to be very complicated. I think that also we have to focus our prevention in the whole population, but taking into account that we still maintain some risk groups, mainly the men that have sex with men, people who inject the drugs. But I think that the whole population should know what is really happening with HIV, that we are all people on risk. And let me say clearly one thing that for me is important. We have a trend of new infections among young adults. So it's not well known, but it's happening right now. So it's something that we have to tackle with the new strategies. First, let me say one important thing. It's very difficult to fight against HIV without universal health coverage, not only in Europe, across the world, because migration is already happening. And we know there are some problems in the sub-Saharan Africa. And of course, it was mentioned by Mark, to address the social determinants on health, poverty, lack of education, lack of knowledge about what is happening with the HIV infection is also very important. And of course, fast testing, different options for testing for all the population. And we can discuss later about the European Health Data Space and the challenge that we have also in this European Health Data Space regarding privacy, because privacy is also important for people with HIV.
This is an ongoing debate in Brussels. If we've time, we'll get to it, but we could talk about that alone for hours on end. Julia, let me ask you to join in. Mark has already lauded Spain as being a signatory. So tell us from your perspective in the Spanish ministry whether we're going to reach those 2030 targets for the EU as a whole.
Good morning, and first of all, thank you very much for inviting the Ministry of Health to join this important session. Thank you to Gilead and the European Parliament for organizing this, and to Mark and Jill, who truly is a champion for the HIV response. I fully agree with the comments and reflections that my previous colleagues have outlined, and I think we can make and we can meet those targets, provided we are committed to do this final effort. Again, as Nicolas also mentioned, we cannot forget how the European epidemic is nested within the global epidemic. So a global health approach is key in order to respond. If we look at Eastern Europe and the Russian invasion of Ukraine in the last years and the impact that this has had on HIV epidemiology and on the burden of HIV care in some countries such as Poland, of course, this is not going to end. At the same time, there are emerging challenges, and we can only look a few years back and see what the COVID-19 pandemic or the Mpox global outbreak has impacted our responses. So we really need to have a global health approach to end AIDS as a public health problem by 2030. And I am thrilled that we are discussing here so many innovations. Innovations are essential, and many of the private companies have put a lot of effort and huge investment in advancing the HIV innovation agenda. But it's important that we understand that biomedical breakthroughs alone are insufficient, and if they are not accessible to all. And again, I echo Nicola's vision that without universal healthcare, it's going to be very, very difficult to reach those goals. And I just want to end up this initial intervention by acknowledging the joint work that we have done with civil society, with UNAIDS, ECDC, WHO, Europe, during the Spanish presidency of the EU Council only last semester 2023, where the elimination of HIV-related stigma was identified as a political priority of the Spanish presidency. And this led to important steps. One of it was the signature of joining the Global Alliance of UNAIDS to eliminate all forms of stigma and discrimination that Mark and Jill has already mentioned. And initially there was only Luxembourg, then Spain joined, and I believe Germany also joined. It's the third country to join this global partnership. It was announced by German Chancellor during Munich IIS Congress. So just want to end by thanking you again for bringing us all together, and I really look forward to fruitful discussions. Over.
Thank you, Julia. And indeed, you mentioned COVID. I'm sure we will draw lessons and ask questions regarding what lessons can be learned from that. Nicoletta, let me turn to you to ask you for your opening thoughts on the overarching question about whether we can reach these targets. What do we need to do? Who needs to be involved?
Well, first of all, thank you for inviting me here, and thank you for taking into consideration the voices of communities. I think that, yes, going to your question directly, yes, we can reach the target, but the next 5 years are really crucial. We really need to act fast, promptly, and responsibly. And I think that to end HIV in Europe, we need a meaningful EU-wide HIV action plan. Because community living with and affected by HIV in our European region have many unmet needs still. So we need a plan that should really respond to these intersecting inequalities and also health and social care needs. The priority, I think, for the EU HIV action plan should really focus on health-related quality of life of people living with HIV, including key populations. But I think we need to start, and we only have 5 years, we need to start really learning the language of key populations. We need to be able to be there with them and for them, and rather than making assumptions. So I'm all in favor, as previous speaker said, of a global health approach, and globally accessing healthcare is vital. But also we really need to start thinking that one approach doesn't fit all. In order to reach every single person, as every single human being, we need to understand how to reach them. And I think that is important then that we start understanding what stigma and discrimination mean to people living with HIV and to population greatly affected by HIV. So the EU HIV action plan, as I see, is an opportunity to implement, for instance, trauma-informed approaches. It's vital that we need into consideration the voices of communities, not just as a tick box exercise. It's important that communities are at the center, not at the periphery of any conversation. We shouldn't just be invited at the table when the table is already set. we should be able to be in a situation in which comfortably we ask the questions and together we find solutions is important. And I think that with regard to reaching the 2030 target, if we want to make Europe better for all citizens, I think we need to start addressing discriminatory practices that punish vulnerable populations, irrespectively whether they're living with HIV or not. I think we need to start addressing laws and legislation that facilitate the movement of people, not just because they can access healthcare, which is vital and important, but also because they can access education, they can access employment and so forth. I think we need to start thinking about interpersonal violence and the side effects of interpersonal violence to all of us. And then the HIV action plan for Europe will have a powerful meaning. Then we can really realistically think about reaching the target by 2030. I can go on talking about the importance of involving community, but I think that I want to leave this conversation open and continue later. Remember that this is about human rights, it's about people's lives, so it's vital that Europe takes the responsibility to do something now.
Thank you very much, Nicoletta. I think we're going to have quite a lot of consensus in today's discussion. Christoph, let me turn to you as you're bringing in the physician viewpoint, as it were. So give us your thoughts, please.
Yeah, well, first, thanks from my side as well for inviting me, the organization, to Gilead and the Euractiv group to make this meeting possible. Exchange is a very important thing, and I'm happy to share my physician perspective. And Giulia Delamo already introduced several activities that happened during 25th World AIDS Conference that I had the honor to host as a local co-chair in Munich. It was an amazing meeting, and it reminded us that HIV is still a global threat. We've heard it already from the previous speakers. There is more than 39 million living around the globe with HIV, and it's 630,000 every year dying by AIDS. The latest UNAIDS report states it's more than 1.3 million HIV new infections diagnosed per year. We can only end the global fight or win the global fight against AIDS once we keep the global perspective in mind. Ukrainian war and the Ukrainian refugees, where Germany is caring for more than 1 million alone, had several impacts on the European HIV epidemic situation. And why is this important? Because although in Europe, HIV prevention, diagnosis and treatment options are available and could save life, there is still lots of room for improvement to bring the adequate prevention tools to those at the greatest risk of HIV infections, to make diagnosis and treatment available. And even within the European Union, every third HIV infection is diagnosed at a late stage. That means including AIDS-defining diseases. And even at our university hospital in Munich, we still see several cases of AIDS-presenting patients, regardless of the opportunity to save those lives with ARV. We must do better to reach the most vulnerable populations at risk, to offer them prevention, diagnosis, therapy and treatment services. And this is not biomedical approach only. We've heard it already. It's also an accessibility. That includes novel prevention strategies, including telemedicine, home and self-sampling, and other innovative ways that are at that time under several barriers and that could not be fully executed to the most at-risk individuals. We must ensure that the full spectrum becomes and remains available, including the most neglected and marginalized populations. And that means we need to really individualize the health approach and keep in mind that HIV is not only an infectious disease. We must address the full spectrum of psychosocial aspects associated with HIV.
Thank you very much, Christoph. Mercy, let me turn to you. Now, I outlined very briefly the 4 recommendations of the report, but the full report title is Going the Extra Mile to End the HIV Epidemic. Tell us what that extra mile is and whether we are going to hit those 2030 targets.
Absolutely. I'm really happy to be here. So the report consolidates evidence based approaches across kind of 9 different countries, and it's all about removing barriers to services. So we know that in the report we outlined 3 key enablers to get us to reach those 2030 goals, which we are currently not on track for, and it's less than 2,000 days away. So the 3 enablers are that there needs to be sustained resources. So we've really seen over recent years that HIV has really been deprioritized, and so it's critical that we sustain the resources and investment that goes into this. The second enabler was around driving innovation across the care cascade. So whether that is about getting people tested and supported through a new diagnosis, or whether it's about supporting people to live long term with HIV, we really need innovation and individualized approaches, and that's something that we highlighted in the report. And the final key enabler is about implementing differentiated service delivery. So again, it's back to that individualized care and recognizing that not every community is going to need the same things, and not every person is going to need the same things. I've lived with HIV for 26 years now. What I needed 10 years ago, I don't need today. And what I might need in 10 years is not the same as what it is today. And so we need to make sure that we have healthcare systems that can support people on their kind of journey. And then in addition to the 3 enablers, we also outlined 4 key priorities, which you've already touched on. But I think what's really important about the priorities is that we also outlined key issues, which are that HIV is deprioritized, communities have been disregarded, and quality of life has been overlooked. And with those 3 key issues, we're not going to be able to fulfill a world where PrEP is properly resourced, where opt-out testing is available for people, where care is available beyond the usual settings, and where quality of life and equity really drive what we do for people living with HIV. So those are just some key kind of takeaways from the report. And yeah, obviously looking forward to discussing more fully what I think. But ultimately, we're not going to reach those targets if we go on the way we're going. And this report is about pushing us in the direction of going that extra mile to be able to do so.
We'll drill down into some of those indeed as we go through our conversation. But finally, Neil, I will turn to you. I mean, as part of the organisers of today's event, why did you think it was important to have this discussion at this juncture?
Thank you very much. So we're at a critical time now, 2024, just 5 years to go, as Mercy said, about 2,000 days before 2030, when all governments have publicly committed to reach the UNAIDS goals. And I think this report is really timely in asking the question, are we on track? If we're not on track, what can we do to get on track? And I think we've made tremendous progress since the HIV epidemic first materialised. And we now know we have all the tools to be able to end the epidemic, essentially, whether that's social tools or biomedical tools or prevention tools as such. But the question is, are we going to go and deliver on that extra mile to end the epidemic? And I think, when you run a marathon, you always know the hardest mile is the final mile, and that's where we are now. And I think, to pick up on a point that Mercy made, is that if we carry on doing what we're doing today, we're not going to get there. And if you look, and that's sort of manifested by, if you're looking at the number of deaths, the number of new infections that have happened, since the pandemic, they flattened out, really. So I think the question is, what do we need to do to bend that curve to get it going in the right direction by 2030? And we've heard from all the panel some suggestions and ideas about what we need to do. And I think I won't repeat those, but what I'd like to underscore is political commitment and political will. We need that leadership from the EU institutions, from member state governments, to commit and to deliver and to resource the tools that are necessary to end that goal. Because I think it's very hard for civil society and companies like Gilead to do it on its own. We need to work in partnership with the politicians, with the governments, to deliver this goal. And if we do that by working together, I'm confident that we can deliver and meet those targets.
Well, Nicolas, let me come back to you, since you're talking about, Neil is talking about the buy-in of political will. Now, Mark and Julia have already underlined the essential principles of human rights that underpin this, and talked about universal health coverage. What's your take on this, and where do you feel the political will can drive change?
First, let me mention that at national level and member state level, we have some initiatives that was mentioned before. Luxembourg, Spain, and now Germany are working on that. But there is a lack of other member states, and mainly those member states where the epidemic now is increasing. So we have to highlight this, and we have to call the attention of other people from these member states, also in this House, also in the European institutions. But let me be clear, we have to create a policy framework in the European Parliament and also in the Commission in order to get on track to 2030. And it's very important to mention this, funding and allocation of this funding to continue support research and development in the HIV treatments and early diagnosis and also prevention. Because it's true that we have EU4Health and cohesion funds and so on, but you know that EU4Health now is getting poorer, and all this funding is continuous peaking from other fundings. And of course, Horizon EU is one of the main programs when it comes to research, when it comes to innovation. So we had to continue support dedicated funds, not only for Horizon Europe, also for programs of HIV in Horizon Europe. And of course, enhance awareness and education, to promote education, not only on the risk groups, of course in the risk groups, but say to the people, to the young people, that this could be hiding epidemics. Because yes, we can manage people with HIV, with ARTs treatments, but of course, we are going to have more infections. So prevention is key, raise awareness is key, support public campaigns at the European level is also important, and we can do it here and provide these campaigns to all the member states, mainly focusing those member states where the epidemic is increasing right now.
Well, that's very interesting, because I see a question coming in from one of our audience members. Jacob Osborne was asking, what is the role of the EU in supporting and funding research and innovation and to create new tools to prevent or to treat HIV? So I think you've gone some way to answering that. But I'd also like to bring in Nicoletta to get your perspective on where the EU institutions can help lead and work with member states, whether it is through funding or whether that is through coordinating initiatives. Tell me what you think can be done or what more needs to be done.
I think that, well, absolutely, conversation should be happening in terms of resources, financial resources and location of resources. But as I was listening, I was reflecting on the fact that actually there are already a lot of initiatives, and I think that what is still missing is the political will to coordinate all these initiatives, because I think that we all agree that 2030 is the target we want to reach. I think we all agree that we don't want more people living with HIV in situations where they don't have access to care. We want better tests. So these conversations have happened already. What we haven't discussed is who is taking responsibility for taking these conversations forward. So that's when the EU should be in a position to better coordinate what is happening already. Because I do advocate strongly for more resources allocated to communities, because that's where the lived experience is. That's where the knowledge and the expertise is. But then we also need to have, that's why I was suggesting earlier, an HIV action plan, which is EU-wide. So we can talk about global access to care within the conversation of one approach doesn't fit all. Because if we start thinking about, for instance, gender, then we can start understanding, what kind of resources and interventions should be there, or maybe they are already there, but there is no coordination, there is lack of information when it comes to women and young girls, for instance, affected by or living already with HIV. But then I can think about other key populations, but also think about what is happening with those who are in prison, for instance. We can have several conversations about so many key populations intersected into the fact that if there is not the political will to coordinate all what is existing, then we cannot really make a sustainable plan, because the conversation has happened already. So this is the time really to start taking responsibility and saying, I have the capability of leading because I'm the EU and I have the funding, the resources to do it. I want to do it. And communities are following because communities are leading.
Julia, give us the member state perspective on what can be done, if you like, on an EU level. We've talked about whether it could be EU funding towards innovative new solutions, or is it that the EU needs to take a role in coordinating, as if you like, as Nicoletta has suggested, an EU-wide action plan? Because health is, as we know, a national competency. Where can the EU institutions step in?
Thank you for the question, and I agree with Nicoletta's comments. We're all missing this HIV action plan, and the EU, of course, has taken steps, and as member states, I was mentioning the example of Spanish leadership during the European presidency of the EU, and we had the support from the trio, from the countries that were participating in our trio, namely Belgium and Hungary. The Minister of Health of Hungary came to our high-level meeting, and we thought that was an important step coming from a country where the HIV response has areas of improvement. And so, of course, there are EU institutions that can frame lots of the action of our actions and magnify these actions. Of course, the EU can also support those organizations that have the experience and lead the way. And Nicoletta has just mentioned funding civil society and the community. I couldn't agree more with her, not only funding them, but also making sure that they sit at the table from the very beginning, because the advances and the innovation and the really successes, because HIV is a story of success, cannot be explained without the meaningful and full involvement of the community. And I want to mention, for example, funding UNAIDS, and we've had this discussion with Mark and Jill over the last few years. UNAIDS has been championing for human rights and for this vision of public health, global health, human rights and science all together, and having the community at the center. So of course the European Union and member states can support and allocate funding to strategic actions. And if I may just make a comment to Mercy's intervention, and I fully agree and support her vision, perhaps I wouldn't be so negative as to why HIV has been deprioritized. We can turn this round. This also has a positive approach to it. And now working in the Ministry of Health in Spain, I can see why other conditions may need to be prioritized. But deprioritization should not be equated to neglect and denial of the remaining needs. So to me, not being a priority issue in 2024 is a good thing compared to 1994, but I fully agree that it's only 5 years to 2030, and only saying 5 years makes us all feel a little bit dizzy. Over.
Yeah.
Mark, let's stay with this question of funding and how do we maintain and sustain funding to deal with the AIDS and HIV infections situation within the EU, because there is a cost of inaction as well.
Yes, funding, indeed, all of us, we agree we need to invest more and we need to more funding into research still, but also funding into fighting all the other inequalities. This is important. And as Nicoletta said, supporting the communities, because communities, we've seen it from Africa. We can learn a lot from Africa, where the communities played a big role, and funding communities is very important. So we have to make better use of European funds, but it's not only European money, also national budgets have to prioritize this fight against HIV/AIDS. Not everything can be solved here from Brussels. We can do a lot, but we can't do it all by ourselves. I wanted to come back to something I find very interesting, where the EU can also act. We have homework to do, what we can do in the EU, but we have also an international dimension which we have to take care of. And we have to be, as an EU, and the member states have to work together in international platforms, such as the UN General Assembly, but at UN level and other international platforms, to really make sure that the HIV crisis is considered as an important crisis, and that this is a battle that we can win. There is not that many successes where we can see that we have a positive outcome. Here, it's a possibility to win, to make this last mile, as you said, the image of the marathon. So giving up now would be terrible, and we have to focus on this, and we have a huge responsibility. I also believe we need an EU action plan. That's very important. And here in the Parliament, we have this informal working group on HIV/AIDS. I think we have to get active too, to raise awareness, because a lot of colleagues are totally not aware. The knowledge of HIV/AIDS with a lot of politicians is at the level of decades behind. And the whole progress, the success story over the last 40 years, we have to tell that and then say, now, yes, there is success. Let's ride on this success wave and do that extra mile. And therefore, we as politicians, together with the communities, with civil societies, we must, and of course the scientific world, the companies, if we work together, if we push this dialogue, and if we raise awareness, I'm very convinced that we can win this battle.
Well, Mercy, there's a couple of things to unpack there, including the global dimension. We learned from COVID that, of course, infections do not recognise borders. How important an element was that in your report? And what would you say the EU needs to focus on first? Is it getting its own house in order or looking to the global south?
Yeah, I think that's a really important point. This is not just about sort of sorting out one place and ignoring that there's obviously other factors that come from other places, and it's certainly something that we thought about throughout the report. And I know from my own experience of being a migrant that, you know, that is a big part of the journey. I think what we have outlined in the report makes it really clear that we do need to get our own house in order, not just to do that, but also to demonstrate leadership, but doing that by taking in the lessons that we have learned from the Global South. So, you know, for example, I was lucky enough to go to the Barcelona checkpoint about 2 years ago, and that there is a great example of care beyond a usual setting, and something in which I think Europe can really lead the way in demonstrating how we can be innovative and different with how we use our healthcare systems to meet the needs of communities, to drive infections down and get support where it's most needed.
Well, Neil, let me turn to you regarding the question of funding for innovation. I mean, how important is technological advance and investment in innovation and research important to get us on, in the short 5 years we have, get us on target, and of course looking at prevention as well as treatment?
Well, I think we need to look at it as a package, in as much that you can't just do or focus on one element. If you're going to be successful, you have to look at it in the round. And of course, innovation in that respect is really important. You know, we heard from Mercy earlier saying her needs 10 years ago are not the same as they are today. And that's because, you know, communities and the needs evolve and change. And we all, as a society, have a responsibility to adapt and meet those needs, whether it's an HIV patient who, wants to reconsider or consider how they administer or how they take their medicines, people who want to sort of make sure that they are safe and able not to contract the virus. And equally important in terms of service delivery. People don't want to go to a university hospital to get their treatment or get their preventative treatment or whatever it may be. They want to go where they are, where they live in their community. And so we need to innovate in terms of service delivery as well.
Christoph, Neil has said people don't want to go to a university hospital to receive their treatment. But of course, you do a lot of great work in researching and tracking and so on. Tell me a bit about your thoughts on funding, if you like, innovation and research. And I will bring in actually a question here from one of our audience members as well. Margot de Vries has asked whether you believe the EU has provided adequate support for advancing innovation, particularly aimed at improving blood safety and reducing the risk of HIV transmission.
Well, of course, I fully agree. Bringing patients to university treatment centers is a huge barrier. We are fully aware of that, and we do have patients that drive 2 and more hours to seek our services for simple HIV prevention. So from a patient perspective, I would fully agree. We need to have lower barriers in accessing care, and the needs are totally different, coming from dedicated risk groups, from different situations, rural and urban areas. In Germany, as in many countries, HIV care facilities are located in the bigger cities. But at the same time, this is a big barrier to people in the rural areas. So I would strongly recommend, first, to seek the full package, as I've said before, prevention, diagnosis, and treatment, to make targeted health offerings in the dedicated EU member states, including innovative ways. On AIDS, there has been innovative ways of automated vending machines for HIV tests and HIV PrEP services presented from Eastern European countries, where people can access 24/7 care with an automated and telemedicine service approach that is, in my view, really innovative, because it's probably not convenient for our patients to seek our services when we have open or when we are on service, but it might be easier to combine different approaches. We must study these approaches and see whether they are feasible and to be implemented in the different member states, and therefore it needs the legislative regulations or the regulations to allow such implementation of those technologies. Second, regarding biomedicine innovation, HIV therapy innovation in the latest 20, 30 years was an incredible, fascinating thing to me. I think the field of HIV is one of the most innovative ways, and we must ensure that innovation continues. On AIDS, there has also been data presented on long-acting prevention methods that are even superior to the highly efficacious oral PrEP options in neglected or in populations where we know where PrEP is not working, which is female and people who inject drugs. So that's the value of biomedicine innovation that comes up, and that clearly demonstrates in studies that there is still room for improvement. And that means we need to keep funding on biomedicine innovation, but not only to develop those innovative ways of care and drugs, but to make them accessible in the different member states and countries to allow the patients at risk to seek their treatment. And I must say, even in Germany, we see for that year, for the first time, not further declining, but even inclining HIV new infection rates, despite universal and publicly reimbursed PrEP services, access to diagnosis and therapy. And that reminds me that there is further action needed, and I completely agree there should be an EU action plan to allow and enable the different member states to keep the fight going against HIV. Innovative drugs is one part of the puzzle, but innovative care and novel options might be even more crucial to win the fight. There has happened a lot, but there is still room for an extra mile.
Mercy, Christoph said there, patients driving 2.5 hours to get treatment. I mean, that's not reasonable or feasible, is it? I mean, what sort of suggestions do you make about bringing care and treatment closer to people in the report? And also, let's move on another step as well and talk about the importance of early diagnosis. I mean, if you have to drive 2.5 hours to get treatment, how far do you have to drive to even get tested? Tell us about that.
Yeah, so I think what you've touched on is a great example of the fact that even, you know, within the EU and EEA regions, we still have people who are unable to access care and services that are close to them, and that is simply not acceptable. And so the Barcelona checkpoint is one of the examples that we've really highlighted in the report as an example of how to bring care to people where they're at, and looking, you know, at different communities and needs that people have to be able to do that. I was previously on the board of an organisation called the Sophia Forum, which focuses on women living with HIV. And one of the things that we've highlighted in the report is the need to be able to get PrEP into the hands of communities that vitally need it. And I've completely lost your second question because just
the
remind me.
second question was about how important is it to get early diagnosis?
Yes, absolutely. So I was on the HIV Commission a few years ago in the UK, which recommended to the government that there needed to be an action plan, which has it's led to a couple of new initiatives, one of them being opt-out testing. But one of the things that I saw whilst being a commissioner and visiting a couple of different cities in the UK was that there had been many people who were diagnosed far too late and had ample time and kind of examples of where they had been routinely let down. I know that currently late diagnosis remains stagnant in Europe, levels at 50%. You know, we're not going to be able to get to 2030 if we're in that position. And so it's absolutely critical that we get to people as early as we can. We've already mentioned that young people are getting diagnosed. It really scares me that people my age are, you know, getting diagnosed when they should have had the education and the access to services that they need to prevent new diagnoses. So we need a whole package which looks at education and prevention, which also, you know, addresses the fact that people are going to need quick and timely solutions to be able to get prevention, and then also support more holistically to look at other factors in their life that might increase their kind of risk profile for acquiring HIV, or if they're already living with HIV, thinking about how best to support them to live well with HIV so that they cannot pass it on the virus.
I mean, Mark, access to services is one reason you might see late diagnosis, but there's also stigma attached to going and getting tested. I mean, what do we do with that problem?
We have to democratize it more and make it something normal. I saw examples in Africa where on the market you had test and treat immediately, tents where people went and you were not... We have to say it's nothing but get tested. And the earlier you know your status, the better it is. And explain the progress and this fear of test. A lot of people still are very afraid of this testing. And there also we have to find a new narrative to tell people it's good to know your status, because then you can have a normal life. All this formidable research and all these formidable advances we've done in the 40 years, the general public are not aware of it. We are aware of it. We are in our bubble, and we have to bring this message outside. And then there is so many contradictory laws. I want to give a very concrete example. There's in one member state, I won't name it, I'm not here to blame. In one member state, refugees, if they are HIV positive, their treatment is paid. But PrEP is not paid, prevention is not paid to them. So you see these little contradictions. We have to invest more in prevention and therefore politicians have to really be more aware of it so they can check the laws in their countries. They can check how prevention is paid also to vulnerable and key populations, and not only treatment, because it's so easy when it's a question of budget. And maybe sometimes we have to talk to finance ministers too. Invest in prevention, it will help you, because paying PrEP is much cheaper than paying ARV treatment. And we have also to get the conversation out of the medical world, out of the ministries of health. We have to bring it into the ministries of labor, into the ministries of finance, into the ministry of economy, because because we lose so much money if we don't reach our and so much potential, human potential. It's not only about money, the human potential, which is important for our economies, and therefore we have a lot of work to do in narratives and conversations and information.
Well, staying on this topic, Neil, I'll bring in a question from an audience member. Bertrand Audouin is asking, do you think the EU can help with having more of its member states promote and disseminate PrEP?
Well, yeah, I mean, that's an interesting question, Bertrand. And I think what we've seen the EU do in sort of health emergencies and in pandemics is procure treatments, medicines are made available for member states. We saw it during COVID, but we've also seen it recently during mpox. And so there is an open question, could or should the Commission provide some support to member states? And another issue is, I think, the EU is very generously supporting the Global Fund, I think to the tune of 700 million euros a year, which is quite a substantial sum. And I think there is an argument to say that's great, but let's also fund or support those member states that we've mentioned who are experiencing a particular high burden, whether it's because of immigration or low income status, to get them on track to deliver those UN targets.
Julia, let me bring you back in there as well, because Mercy mentioned the Barcelona checkpoint. Perhaps you could give us a sense of what's being done differently or what sort of stigmas are being broken down to encourage people to get both screening and treatment.
Sorry, can you repeat your questions? I couldn't get it.
Sorry,
Jen.
Julia. Can you tell us any bit more about the Barcelona checkpoint and what it's doing well, or other examples of clinics that are working well to break down stigma around testing and treatment?
Well, the Barcelona checkpoints are a model. Really, they've done fantastic work, and I can only have admiration and praise for the work they do. There are many other clinics in the country that are also doing very good work, as much as they can, inspired by the model of Barcelona checkpoint, which, as has been mentioned, is led by the community in a neighborhood where the community of gay men live and where they feel comfortable. I agree with Christoph's comment about the challenges of getting people at risk for HIV to go to have to visit hospitals, university, or just local hospitals. It is a challenge, but also it's important that we bear in mind that member states, also in Europe, need to adapt the current resources to the emerging needs. And when we needed to engage large numbers of people on PrEP, unfortunately, the facilities that are available in Barcelona checkpoint were not available everywhere in the country. So we had to do the best we could with what was available. So acknowledging the excellency of Barcelona checkpoints should not undermine the huge efforts that smaller areas, smaller cities have done to cope with incorporating PrEP users into their healthcare delivery. Over.
Nicolas, I know you're on the Sant committee, not the education committee, but how important is education around the question of HIV and AIDS in breaking down stigma and encouraging people to get tested if they are in an at-risk community, but even also just to work on issues of prevention?
First, let me remark that I also agree with Mark when he said that the existing story of HIV right now is a story of success. At the very beginning, it was a sad story. There are discrimination, deceptions with a lot of people, but now it's real a success. So we have also to transmit to the people that this is a success, and we can fight against HIV with success. So I think that all the strategies, all the information strategies should remark that we can fight against that, but people has to be diagnosed, and people have to work also in prevention with local communities, of course. For me, the main concern is about this new generation of young adults that really don't know what is really happening with HIV. And now we have a controversy. We have this social stigma, but we need to use a lot of data from the people. So we have to engage people in order to collect this data. We are working at the EU level with the European Health Data Space. There is an opportunity for innovation and also to raise awareness and the use of secondary data collection to develop, for example, new treatments or the possibility of therapies that can help to have less secondary effects or even vaccines. So this controversy could be also in the public debate, even in social media, because we are going to use a lot of data from people and they can say, oh, my privacy regarding HIV is very complicated, that I deny to use my data. So there is an important issue here that we have to tackle and we have to manage in future, because we need all this data. We need to standardize and harmonize data. We need standardization of the collection of this data. Sorry, but I'm speaking now as a professional, a health professional. But for me, I think this concrete issue is very important. We need this data, but we need to support privacy and also to discourage people that is still putting stigmas on people with HIV. I think that this my main concern, and as I said before, in a special group of people that are young adults that are very influenced by social media and for fake news right now. So fake news and this not true that we are living sometimes is also a problem in the social campaigns that we need.
Well, it is that social stigma and so on that may result in fewer people wanting to give away their data because they fear it might be leaked.
Yes, they can feel that their privacy is in risk. This you can imagine a migrant coming to Europe suffering HIV and they don't have all the rights that all the people in this country have, and you are asking him the data and he can feel, oh, I will have some problems. I'm new here. I really don't know what is happening. So this could be a problem.
Nicoletta, let's talk some more about stigma and discrimination. There are inherent barriers to getting treatment and getting tested. Can you give me some insight into what sort of challenges those pose and how we might overcome those challenges?
Yes, but can I just say something before I answer your question? I think it's important that we say that everyone is at risk of HIV, not just because we have been talking about people who are at risk of HIV, which then links to stigma and discrimination. But in reality, all sexual beings are at risk of HIV. And I think that when it comes to education, when it comes to understanding access to testing and all the conversations we had thus far, I think it's important that the message is out very clear that everyone is at risk of HIV. I'm not talking about, creating panic or anything else. I'm just saying, I'm suggesting in relation to the HIV action plan at European level that I mentioned earlier, as a proposal, that I think this should be very clearly stated, because then we can then talk about the meaning of stigma when it comes to accessing testing, when it comes to accessing healthcare in general. It's easy and very difficult at the same time to address stigma and discrimination, because at one level, you can easily address stigma and discrimination by making sure that legislations that are already discriminating and punishing vulnerable populations are revisited. So, you can easily do that by, making sure that you address all the issues related to and affecting those who are using drugs, those who are involved in sex work, and so forth, those who are migrants, for instance. Then you can dissect stigma and discrimination because you're already addressing some of the key barriers at a much more, if you like, personal level, as in every single individual accessing healthcare and accessing testing. I think what is easily achievable is a mechanism for monitoring HIV and AIDS related stigma and discrimination in the healthcare setting. I'm not talking about the very lovely bubble that is the HIV care. I'm talking about everything else that happens in the healthcare setting. Most people living with HIV will experience comorbidities. So we must educate healthcare professionals outside the HIV bubble in order for people living with HIV not to be discriminated and not to experience stigma. We have mentioned COVID earlier, although I would dispute in a different setting that the experience of COVID is not the same experience as HIV in terms of mobilizing community and in terms of stigma and discrimination. HIV still magnifies vulnerabilities in society. COVID did it to a certain state, but not in the same way. I think it's also important when it comes to, we mentioned confidentiality, we mentioned standardization of data collection. These are all impacting on the experience of stigma and discrimination. Solutions are there, because if you think you can, if you want to address this issue, you can use HIV, which, as I said, magnifies discrimination and stigma and injustice and human rights violation, and you use HIV to make Europe a better place for all citizens, because once you have addressed these issues in this container, which is HIV, then you have addressed the issue of human rights violation for many other vulnerable populations. And those vulnerable populations will not be vulnerable anymore, so they can access testing, they can access healthcare. We haven't even mentioned, for instance, all the issues related to retention in care. There are so many people living with HIV in the European region who then leave care. And there are so many reasons, most of them related also to stigma and discrimination, and the inability of speaking literally the language of the communities. There is still, in many member states, this very huge dichotomy and power game between patients and clinicians, between patients and healthcare providers. It's very difficult in some member states to find ways in which patients are at the center of the care plan. This is very important.
Thank you, Nicoletta. I'm going to touch on a couple of things and ask a couple of questions with comments from our audience before we go to a final wrap-up round. Magdalena is asking whether the Polish presidency of the EU could be used by the civil society community or indeed the HIV supporting community to put more pressure on the EU. Maria says, how can we leverage the European Commission focus on prevention to ensure that HIV prevention is sufficiently prioritised and funded? And both of those feed into my question, Mercy, which I'll put to you first, which is how do you maintain political momentum and how do you keep something like HIV top of mind? Because we know we've come a long way from the crisis point in the 80s to where we are today. The EU has its, for example, it has its EU Cancer Plan, which was launched on the 4th of February 2020 with a big, huge event here in the European Parliament. We were all here. And then the following month, COVID came along and wiped that from our memories. So there's always going to be some sort of perma-crisis. As Neil mentioned, there was Mpox more recently. How do you keep people's focus on one thing, which they may think, oh, that's not a problem anymore?
Yeah, I think this goes back to what I said earlier around one of the key barriers we've highlighted is around the fact that HIV has been deprioritized. And what we mean by that is there's this air of complacency around HIV, which is really dangerous. So we know that 1 in every 8 people living with HIV is undiagnosed. And so we cannot take our foot off the pedal. We can't afford to take our foot off the pedal. You know, the HIV epidemic is one that's really interesting in the sense that if we slow down or take our foot off the pedal, it's just going to exacerbate and get worse. And so one of the things that we do in the report is really set out the cost of inaction, the cost of complacency and not meeting these targets. And I think that, you know, please do go away and read the report, because it is a good wake-up call in terms of actually, if we don't do this now, then we are going to be facing, you know, a world where we have to pour more investment and time into this, where it's going to destabilize health systems, you know, in response to other future pandemics as well. And so we need to make sure that we are keeping a robust focus on HIV, whilst also acknowledging that there are other things that we have to balance. But it is about recognizing that if we do not do all that we can to meet the goals that we've all agreed to, you know, we're not, no one's asking for a favor. This is something that politicians came and said that they wanted to do. And so it's ultimately about accountability, not being complacent, and saying that we have the power in our hands to do something. We have all the tools that we need. What we don't have is the will to do it. And that's the most important thing.
Christophe, complacency is dangerous, says Mercy. How do we tackle that? How do we manage this danger?
Well, it's a difficult question. From a medical care provider perspective, I would say we must ensure that the techniques we do have will be available to the different populations at risk, as we've discussed before. It requires political will and action. The plan and the strategy, what to do, is the most important thing. Sufficient funding to realize the plan into the clinical practice and routine is crucial. And latest, to keep on going, discovering innovation. We've heard in the Barcelona checkpoint as a role model. I would say we have them around Europe. This is a great initiative. But we now have even newer approaches, telemedicine approaches, to make health information as well as health services universal, available within the different EU countries. And there's lots of initiatives of the member states have talked on the vending machine and other new ideas to rethink care. That's the most important thing. And I must say, it's important that we keep the focus on HIV, because you've said it in your intro statement. COVID shifted a lot of resources away from HIV, and many member states, including Germany, do target other health challenges. But we've also heard almost every second diagnosis in the EU countries is diagnosed in a late stage. So of course, HIV is a public danger. We need to have political will, a clear action, and sufficient funding to bring it into practice.
Well, thank you, Christophe. I mean, I think we're getting to, we've covered a lot of ground here in the last hour or so. But I'd be interested to hear your sort of closing remarks, bring it all together and try and find a red thread, as it were. Neil, I'll start with you. Where should we be going forward? Which of these big issues that we've raised over the last hour do you think maybe should be a priority?
So we're sitting here in Brussels. Everyone's beginning their new mandate, which will end in 2030. And I can't think of a more or a bigger legacy that everyone in the Parliament and the Commission could have by standing up at 2030 and saying, I played a role, I contributed to the EU, taking a leading role in delivering the UNAIDS goals and ending the epidemic. And I think with the political will, with the right resources, with the action plans, if we implement the report that Mercy's commissioned and recommended, I think we can achieve that goal.
Thank you. Julia, let me get your closing remarks. Not necessarily a new mandate for you in Spain, but perhaps a new forging of the relationship with the new Commission. What would you like to see for the coming 5 years, and how can we deliver on that aim, but very, very clearly stated aim, of actually ending the HIV epidemic by 2030?
I don't think I can say anything more or better than what Neil has summarized. I fully echo his words. There is clearly this legacy for the mandate of new coming European parliamentarians. The response needs to be, of course, at the national level in member states, and many of us are already working at that level, but definitely the vision at the European level is needed. And Nicoleta, Christoph, Nicolas, Mark, Mercy have called for a new EU HIV action plan. I think that would be a very nice way forward. Thank you very much.
Thank you very much, Julia. Well, Nicolas, you were name-checked there in calling for an action plan. Give me your thoughts and tell us, what is the Sant Committee going to do over the next 5 years that will deliver this aim?
First, we have to be a committee.
Well, yes, of course, yes.
But let me say that I am quite optimistic, because today we have enough strength at different levels, and in some countries and communities, of course. But let me remind the political dimension. Some words that we have said before, like universal health coverage, equal rights for all, gender equality, cross-border collaboration, global cooperation, human rights, probably are not the best words for some forces that are growing in Europe. Illiberal and populism is growing in Europe. So these growing forces can put at risk not only free speech of democracy, it's also some things that we think that we have gained in the past that could be a risk. So fighting against HIV could be one of them. But of course, we are still here fighting against those forces. But let me ask one thing, also to the industry, also to the communities that are supporting this fight against HIV. Believe in all those political forces that really believes in universal health coverage, gender equality, cross-border cooperation, and equal rights for all. This is very, very important nowadays.
Well, I think you've broadened our battle field even wider there, Nicolas, but we have to be realistic about what's happening in the world. Nicoleta, your thoughts as we wrap up this conversation. Where are your hopes and dreams going, and where are your fears that's keeping you awake at night?
Well, my hopes first, and my ask. I think it will be quite easy to achieve co-produce research, so we can, with communities, so we can produce meaningful data, and then we can implement all the conversation we have today when it comes to education, when it comes to access of care, and everything else that we have said. I just, I want to highlight a reminder that, HIV magnifies as human rights violations. So by tackling HIV, we are also making Europe a better place. I said it already, but I want to reiterate this because I think it's very important that we see this from this angle. Every human being, because we are human beings, could be affected by HIV, and they're affected by HIV. So you're not tackling only those who are living with HIV. It's the wider community of people living in Europe that we are supporting and helping. What keeps me awake at night is that I actually have seen this before. I have been living with HIV for 40 years, so I've seen many progress. We spoke about, technology, how important, and medical intervention, and the progress in healthcare, which is amazing. But we are still a group against all the others, and I think what is important is meaningful collaboration, meaningful involvement of communities. Not tokenistic involvement. I started my conversation today by highlighting this, and that is my pledge. And I want to make sure that we are accountable. What we have said today really means something, because 2030 is really only 5 years from now.
Thank you very much. Christoph, your closing thoughts. We are on a tight deadline. We have got 2,000 days or so to deliver on a very tall order. What's your final thoughts as we end this conversation?
Well, I've shared my thoughts already. I think the most important thing is to remain with the will, to have the sufficient funding. An EU action plan would be helpful. The initiatives of the member states are incredibly helpful. And the involvement of community is at least crucial to keep the fight against HIV successful. Studies and biomedicine innovation, including the accessibility of the innovation within the member states, is crucial as well. And we've talked a lot on stigma that I will or would like to fully echo. There's still lots to do. And one of the challenges to make HIV in one way to a comparable disease to others, that means living with HIV is fully normal possible, but at the same time, not to lose the targeted audience and the focus on the fight against HIV. And that's part of the balance we need to find at that point to at least make HIV, for those being affected and at risk, as a normal thing in life, and at the same time improve the overall situation and condition within the European Union.
Absolutely, Christoph, and we should undermine, of course, the wonderful technological advances, because effective treatments really do make living with HIV possible. They can prevent transmission during pregnancy, as well as transmission in other ways as well. So it's absolutely paramount that we get that message out. Mark, your closing thoughts. There's a lot to unpack from what we've discussed, but pick a few of your highlights.
I think we have a very short-term responsibility as European Parliament now during the hearings of the commissioners, that we make sure that we continue to deepen the social union, that we continue to work on the union of equality, to end all kinds of discrimination. This is a first thing we have to do. When the hearing of the health commissioner, to make sure that this human rights dimension will be in it, that there will be enough funding. And then we have to work on that EU action plan. I think we need to have a report also here in the Parliament, and I can only call these colleagues who are in the committees of SAND or other committees that we get an initiative report on this. This would be very, very important. And then I think Mercy said it before. I noticed, I put this sentence down. She said, we have the power in our hands. Yes, we all agree, but we don't have the will. We have to get that will back. And if we get that will back, we will get that extra mile, and we can reach this target, which everybody agreed to, and nobody was forced to sign this commitment back in 2015. This was a common commitment, and please, we owe it to the communities, we owe it to our society, and if the key populations, if people living with HIV/AIDS having a better life, we all have a better life.
Mercy, final word to you. You've been working on this report for some time. Wrap up for us by just giving us what you thought were the main standout features that you discovered when writing the report. Was there anything surprising? Was there anything you'd like people to bear in mind when they think about the HIV epidemic in the future and what can be done about it?
I think what really excites me about the report is that the end is in sight. The finish line is there, and that there is the possibility of meeting these goals. It's not a doom and gloom report that says that we won't do it, but actually the fact that the report really clearly outlines that with sustained resources, with driving innovation and implementing differentiated service delivery care, that we can really enable a world where we can all push forward and get this achieved. And so that's what I want to end on, that it is possible, it is achievable, and it's only 5 years away. So we really just need to get cracking, implement an action plan, be accountable to what we've promised, and deliver on that for communities.
Thank you very much. So I think it's fair to say from everybody there's been quite a bit of consensus about the need for an action plan. So perhaps a big call out to the new Commission as it settles into its new mandate. We'll see who the Commissioner will be. We'll be watching, eyes will be here on the European Parliament with those hearings as well in the coming weeks. Thank you very much indeed for our great speakers, for joining us, for having this conversation today. Thank you to Euractiv and Gilead for organising it, as well as, of course, the European Parliament tech team for making it possible. And as always, you, our audience, for joining in that discussion online. Thank you for sending in your questions. Remember, you can follow more Euractiv debates by using the hashtag EA Debates, and do check out our new X or Twitter account, which is EA Advocacy Lab. So please do that and have a great day today.